Thanks for joining us. In this audit, we looked at Northern Health's recruitment and retention of rural and remote nurses. The Northern Health Authority is responsible for planning and delivering health services to approximately 300,000 northern BC residents across a largely rural and remote territory covering about 2/3 of British Columbia. Our audit looked at whether Northern Health was effectively recruiting and retaining enough registered nurses and nurse practitioners to fill the rural and remote positions it identified in its 2016-2017 Health Human Resources Plan. We concluded that it was not. As of last April, more than a quarter of Northern Health's rural and remote nurse practitioner positions were unfilled, and it was short 121 registered nurses, or 15% of its rural and remote workforce. Not having enough registered nurses and nurse practitioners can negatively impact patients, staff, and the organization. We found that RNs were challenged to meet the needs of patients in the community as well as those of patients in acute and long-term care. RNs were also worried about patient safety because they were not always able to adequately supervise patients or perform regular equipment and medication checks, and because they were tired due to working long hours, thereby increasing the risk of medical error. We found evidence of nurse burnout, by which we mean the effects of prolonged stress, including emotional exhaustion, disengagement, and reduced performance. And finally, there were higher overall costs to fill shifts due to paying overtime and for more expensive nurses via agencies. Both external and internal factors contributed to the nursing shortage. Northern Health cannot influence external factors like weather and isolation, but it is directly responsible for or can influence internal factors like the implementation of interprofessional teams. RNs on the interprofessional teams provide primary care nursing services, including public health and home care. In the past, many RNs focused on just one of these areas. Some are not interested in or don't feel comfortable expanding their practice to other areas without additional training. In terms of management, we heard examples of registered nurses choosing one community over another because a hiring manager was quick and attentive throughout the recruitment process, while in other cases, RNs left their position due to poor management. Areas close to a nursing school enjoy a greater supply of registered nurses. There isn't an RN training program in the northeast part of our province, and many people we spoke with indicated that this contributed to the significant shortage of RNs in this region. We made 9 recommendations to address the root causes of the registered nurse and nurse practitioner shortage and close the gaps between good practice and Northern Health's current state. These recommendations include developing comprehensive recruitment and retention strategies for registered nurses that have clear goals and performance measures to guide Northern Health's activities and enable it to assess its progress. Establishing clear responsibilities for all aspects of its recruitment and hiring processes, including oversight. Working with other organizations to develop new recruitment and retention programs and address systemic issues like housing availability and affordability, and the distribution of nursing education programs in the North. That's our summary for today. Thanks for joining us. To read this report and others, or for more information about us and our work, please visit our website at www.bcauditor.com.